So next we have Carrie Thibodeau and Kristi Coldwell, who will talk about the patient family donor perspective on the organ donation and transplantation system in Canada. Carrie has served as one of the project leads for the Improving Engagement and Empowering Patients on Their Transplant Journey project. Her educational background is in the field of applied health sciences and communications, and the focus of her professional career has been on kidney health. She has worked closely with both patients and medical professionals for many years, and she has collaborated on multiple projects with the Kidney Foundation of Canada. Kristi is the Senior Advisor for Transplant Research Advocacy at the Transplant Research Foundation of BC. Having undergone a heart transplant as a teenager due to congenital heart disease, Kristi is acutely aware of the role research plays in improving outcomes and enhancing quality of life. She believes patient and family partners have an important role in shaping and informing research to ensure it is meaningful and accountable to all stakeholders. She also serves as the co-chair for the Patient Advocate Advisory Committee of the Organ Donation and Transplant Collaborative, a Health Canada initiative that brings together key stakeholders in Canada's ODT system. Over to you, Carrie and Kristi.
Thank you very much, Sarah. Hi, everybody, and thank you to the CDTRP and the organizing committee of this forum for the opportunity to speak to you today about the results of our project, which is called Improving Engagement and Empowering Patients on Their Transplant Journey, or My Transplant Experience for short. Before we begin, we would just like to recognize the Indigenous land that we are on, inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada. Land acknowledgements are a necessary first step towards honoring the original occupants of a place. I live and work in Newmarket, which is situated on the traditional lands of the Wendat, the Haudenosaunee, and the Anishinaabe people, and the treaty land of the Williams Treaties First Nations and other Indigenous peoples whose presence here continues to this day. Next slide, please. This is our project team. Kristi Coldwell and Lydia Lauder, who are Patient Advocate Advisory Committee co-chairs, myself, and our research team, Dr. Sandra Davidson, Dr. Sarah Duell, Mark Hall, and Danielle Fox. The project was funded by Health Canada and led by the Kidney Foundation of Canada, with research expertise from the University of Calgary and support from the Canadian Transplant Association and the Canadian Donation and Transplantation Research Program. Next slide. So today, we're going to start with a brief overview of the Organ Donation and Transplantation Collaborative and its Patient Advocate Advisory Committee. We'll talk about patient, family, and donor engagement during the project, and then we'll go over the details of the study. And then finally, we'll focus on the patient-led recommendations that came from this important work and talk a little bit about how we're beginning to share what we learned.
Thanks, Carrie. So I do want to just briefly highlight that this project that we're going to be speaking to today is actually part of a larger initiative known as the Organ Donation and Transplant Collaborative. So the collaborative began around 3 years ago. It is time limited and it is led by Health Canada with the goal to achieve organ donation and transplant system improvements that result in an increase in the number and quality of successful transplants and improved patient outcomes. And in order to do this, central to this process is bringing together key stakeholders in our ODT system, including researchers, clinicians, organ donation organizations, and patients, families, and donors, just to name a few. Next slide, please. So central to this, of course, is our Patient Advocate Advisory Committee. And so to this end, this group was created, and it represents a formal structure that is part of the larger collaborative that really brings together individuals who have lived experience of our organ donation and transplant system, including our patients, our donors, our caregivers, as well as patient advocate organizations. It really helps to embed these various perspectives and voices throughout the work of the collaborative, including across various working groups, in projects and activities, and ensures that our voices are part of decision-making and priority setting. And in our project that we're speaking to today, actually it was initiated by our PAC members. So this is a project that is for patients, families, and donors by patients, families, and donors. Next slide, please. Next slide, please. Oh, I think there might have been one before that. Oh, there we go. Perfect. Thank you so much. Just a little hiccup there. So you might wonder, why is this so important to have a project that is patient-led and patient-initiated? So it is so important because it really helps to ensure that the research that is being funded, including our own project, is truly addressing what matters to patients, families, and donors in our organ donation and transplant system. And how do we ensure that we are doing this? So not only do we need to ask them what matters to them, but we need to engage them every step of the way. And that is exactly what we did through this important work. Next slide, please. So, and I'll just give you a little bit of a breakdown what specifically this looked like. So right from the very beginning, we engaged our patient, family, and donor partners, PFDs, partners for short, by helping us to really reaffirm the importance of the research question, to help us define our project goals. And they were also central in working with us to make connections and form partnerships and networks with the broader organ donation, the broader patient, family, and donor community. And this was central in ensuring that we had diversity in perspectives as well as inclusion across our country. And then when it came to our resource inventory, which Carrie is going to be touching on a little bit later, they were really key in working with us to not only compile, but to identify resources, supports, and education tools that were going to be relevant and useful to other PFDs. And more specifically, related to our online survey and focus groups, we turned to our PFD partners to help tell us what should our questions be that we want to ask. So they worked with us to help co-create and to develop these questions to ensure that they were understandable and that they were really targeting what we were intending to address as part of this work. We also had our PFD partners moderate some of our focus groups. And now that our project is wrapping up and in its conclusion, we are also working with them to really ensure a robust and really dynamic KAT strategy. So one that doesn't just help ensure our project findings and recommendations get back out there to the more traditional means of academia, but also to the broader PFD communities, organizations, and individuals. Next slide, please.
So the goal of the project was to help the Organ Donation and Transplantation Collaborative to better understand and address patients' lived experiences and meaningfully inform its recommendations to the federal and provincial territorial governments on a new path forward for the ODT system in Canada. In order to achieve this, we set out to improve the products and services that are available to transplant patients and their families, to empower people on a transplant journey to navigate the system and to advocate for themselves, and to develop recommendations for renewing and improving the transplant experience from the perspective of people with lived experience. Next slide, please. So as part of this project, there are two main ways in which we plan to gather information on the organ donation and transplantation system. We were looking at the accessibility, the responsiveness, the quality, the sustainability, and the accountability of the system. And the first way we looked at this was the online survey. It was open to anyone on a transplant journey, as well as their care partners and living donors. As Kristi mentioned, our patient partners in the Patient Advocate Advisory Committee were instrumental in developing and pilot testing the questions that we ultimately used in the survey. And we asked questions about the transplant journey itself, product, services, and support that were available to people, navigating the system, living donation, and COVID-19. We posted the survey online. It was available in 5 languages, and ultimately 994 people across Canada shared their transplant experiences with us through the online survey. Next slide, please. So the second means of gathering information on the ODT system in Canada was a set of focus groups. We had 4 groups for a total of 20 participants, and we met virtually twice last year, once in the spring and then again in the fall. The first online focus group included questions that delved further into the lived experiences we asked about in the survey, and the second focused on the themes and opportunities that arose in that first round. Once again, we worked with patients, families, and donors in the PAC to develop the focus group questions, which would help us to understand the lived experiences of people on a transplant journey. We were able to have focus group participants from across Canada and across organ groups as well. Next slide, please. So what did we learn? We've completed the qualitative analysis of our focus group data, and it's revealed some important themes and identified several opportunities that will lead us to our patient and family-focused recommendations for improving the ODT system. Next slide, please.
So because this is a project that is fundamentally about amplifying the voices of our patients and caregivers, we do want to take a moment and share with you some quotes that I think are quite impactful that came from participants that participated in these focus groups. The first one relates to the financial considerations. So I had to do fundraising to stay close to the hospital for 3 months post-transplant. I also owned a home and had a family that I had to maintain. The financial obligations are astronomical, and I had to declare bankruptcy not long after my transplant. The next quote is related to services and resources. So I didn't actually have a contact person to ask if I had a question about healing. When I called my pre-transplant rep, she told me to call post-transplant and had no idea who to ask for. The next one combines the two. Mental support and financial support and emotional support, they all go hand in hand. And finally, related to mental health. One participant shared with us they'd like to see better access to mental health services before and after transplant, that there is so little help and what there is costs too much for those of us who are on or have been on disability because of our illness. Help is completely inaccessible for many. And I think these are quotes that really help to bring forward and magnify the gravity of the situation facing many of our patients, families, and donors that are on a transplant journey. Next slide, please.
So the first of our broad recommendations is to prioritize mental health awareness and support to remove stigma, increase transparency, and normalize the conversation around mental health support for people on a transplant journey. We can do this in a number of ways, but these are the recommendations that came from this work, sub-recommendations, I should say. So first, we can do that by integrating meaningful professional support throughout the transplant journey, as well as at through referrals at key points in the process. We can ensure that healthcare providers have all of the resources that they need to support patients. And finally, we can establish peer support groups linked to transplant programs for all organ groups. Next slide, please.
So our second recommendation focuses on expanding resources and services to ensure a more equitable transplant journey for individuals. And this more specifically includes increasing navigational support, as well as support for patient advocacy and ongoing support for a current or an ongoing pan-Canadian a repository, also known as a database of education and resources. And of course, last but not least, to ensure that we reduce the financial burden and barriers for patients and caregivers.
And finally, the third patient-centered recommendation is to improve coordination and continuity of care. So we need to ensure that the communication between and within healthcare systems, as well as to patients, meets the needs of patients and caregivers throughout the journey. So there are a number of ways we can help to achieve that. The first is to establish comprehensive care programs for transplant patients and living donors. Next is to increase support for primary care providers who are caring for transplant patients and their families. And finally, to build on the framework that was established during the pandemic to offer patients, especially those who live remotely or far from their transplant centers, virtual access to care throughout the transplant journey.
And that brings us to the knowledge translation portion of this work. As you can see, we have identified 3 primary groups that is the focus of the KT. They include patients, families, and donors, governments and organ donation organizations, and our research community. So as I previously touched on, our patient, family, and donor partners are really central to helping to develop these strategies, as well as the materials that will accompany them. Next slide, please. So just to give you a bit of a sneak preview at what we have currently in development. So we have our project website, which has been ongoing throughout our project and remains operational. And now that we have our findings and results, we will be updating that website. So I do encourage you to check it out. I believe we will probably be posting that in the chat, the link to our website. And we are also working on a project summary that is going to be shared back to our project participants. So again, these are the individuals who completed our questionnaire and were involved in our focus group. This will also be available to anyone else who wants to learn more about our patient, family, and donors' experiences in our system. And this by no means is an exhaustive list. It is just in progress, and we're actively working with our PFD partners to continue to develop it. Next slide, please.
So next, how will we make sure that the voices of the transplant patients, caregivers, and organ donors who designed, supported, and participated in this important work are heard by the healthcare system? The final report of the project is set to be released and shared in English and French. And we also have a brief stakeholders report to help governments, organ donation organizations, and transplant programs to identify how they might participate in improving the transplant journey. We've presented the results of the study to the Organ Donation and Transplantation Collaborative, and we're also sharing what we've learned through forums like this one. We'll also, of course, be looking to our PAC members, as Kristi was saying, to offer further advice on ways of sharing these results and promoting the uptake and implementation of the patient recommendations that we've told you about. Next slide, please. And finally, we've had the opportunity to present our work at multiple meetings and conferences, including the Canadian Society of Transplantation and the Canadian Society of Nephrology conferences. So these two illustrations that you can see here are the poster presentations that were presented there. The research group within our team is also preparing 3 separate papers for publication in peer-reviewed journals. These papers will help us to share our patient-led research process and our results with the research community. Next slide, please.
So in closing, I do want to highlight that this project teaches us how important it is to understand and to really value the lived experience of our patients, families, and donors, to create and to support an organ donation and transplant system that better meets the needs of those that it serves. And to this end, it is critically important that we take the time on an ongoing basis to ask, listen, and learn from our patients and our caregivers. And next slide, please. And I just want to wrap this up and really thank everybody so much for not only joining us today to learn more about this, but to thank everyone. I know that there are likely some of you in the audience today that were involved in either helping us to design and to create this every step of the way, or also participating. So none of this could have been done without your invaluable support and participation. So thank you, everyone. And also a special thank you to the CDTRP for having us here today and for all of their assistance and help in our important work. Thank you, everyone.
Thanks, Kristi and Carrie. What a great presentation. It's been really exciting to see the journey of that presentation. And now you're at this really important part of sharing your findings and really pushing the socialization of those findings so people can start to implement all those important factors in engaging patients.